18% of the healthcare service workers who came to the Middle East left back to India within a year's time. And out of the 18%, approximately 10 to 11% left back home within a month's time. Now, when we tried to substantiate this, and I made a few calls to my colleagues who are working in Saudi Arabia and the United Arab Emirates, it was very startling to find that the main reason was the inability of the person to adapt to the Middle Eastern environment. Definitely happens with all of us. So I'd like to say that we have an orientation program basically to help the individual to blend with the new environment. I'd like to quote Robert Frost here. He says that, "I shall be telling this with a sigh somewhere ages and ages hence. Two roads diverged in a wood, and I chose the road less traveled by, and that has made all the difference." The Indian Dentist Alliance in Kuwait, that has been said by the President, by the Secretary. I will not elaborate on all this. I'd just like to push forward. According to me, I think that the role of IDAK, according to all of us, is twofold. One is professional development, and second is social interaction. When we bring about an amalgamation between professional development and social interaction, it's going to make sense. So it leads us to a question: what exactly is our mission and vision? I feel it's very, very simple. The past committees and the past rules and regulations which have been set for us have laid a fantastic foundation. And all we need to do in the future is build on it. So, the sole purpose of this orientation program is to lend a helping hand. But if it's only for the newcomers, it will make it very monotonous. So, I try to incorporate a few things which will be helpful, not only for the newcomers, but for all of us. Oh, that's too much. But I had to incorporate all that because the President will kill me if I don't include all that. I'll try to be very fast with it. Once a person lands in Kuwait, not only in Kuwait, in any Middle Eastern country or any Western country, or that matter in an alien environment, he has to adapt himself to the various customs, languages and traditions. This brings about a lot of confusion and insecurity within the individual. Now, one important thing as far as Kuwait is concerned or the Middle East is concerned is the language barrier. We have to break the language barrier to be accepted over here. It's very important that Arabic learning and speaking and a little bit of reading is not become an option anymore. It's become absolutely mandatory. Okay, when I landed in Kuwait, I felt like the cat in the picture. And it takes a lot of time, not a single orientation presentation, but it takes a lot of self-experience for the person to come from that side of the football to this side of the football. Kuwait is a beautiful place. It's a small place. It's got a beautiful amalgamation of desert life and modern urban city. We don't miss our homeland that much because we get a lot of Indian food here, Indian culture, and we have a lot of Indian population staying out here. So, how do we make ourselves visible to the Kuwaitis? We know that not only in the healthcare sector, but it is important in any single sector which you may pick out. That appearance is the single most important thing that distinguishes you from the public. We know that the tip of the iceberg is only 10% and the 90% lies below. But it's only that 10% which is visible to the opposite person. Dress code is absolutely mandatory. we feel that the first impression gives the best impression. So at the outset, we would request the newcomers or even the existing members to follow a dress code, not necessarily one single pattern. Depending on your different wavelength, you can choose your outfit. It can be, initially it can be a formal outfit or scrubs which may be preferred, and later on you can adapt yourself to semi-casuals or even smart casuals as per the need be. Personal hygiene, I don't need to stress too much about this, but we are that sect of healthcare workers who are in extreme close proximity with the patient. So personal hygiene is also very, very important. Posture and body language. Posture for our health and positive body language together give us the confidence we need to face the challenges which we face in day-to-day clinical practice. Now we have a recipe for professional success. I'd like to just discuss this under the 5 ingredients very quickly. We have knowledge. Now, knowledge can be of 2 types. Basically, when we are trying to fight the language barrier, we have the knowledge which is imbibed by our skills and professional practice. We need to acquire knowledge to execute it in clinical practice. And the second thing, if we have acquired the knowledge and we can't put forth it to the opposite person, it's of no use. So learning Arabic language, as I mentioned previously, is absolutely mandatory to give us the required confidence. Research. There's a misconception stating that we're clinicians working here. But there are a lot of dentists working here who have been excellent academicians, staying abroad, working in the polyclinics, working in the dental centers, have fantastic research publications to their credit. And I think we also should follow their path to contribute a little bit to our profession in the form of research. Diagnosis and treatment planning. As far as the government sector is concerned and the private sector is concerned, there are a lot of stalwarts sitting here who have been working here from a long time as compared to me. But I feel, according to the little experience what I have, diagnosis and treatment planning is a day-to-day basis thing for us. As soon as the patient sits on our chair, we try to diagnose and formulate a treatment plan. Now it's a little bit more specific in the private sector because the patients are actually shopping for treatment. And in the government sector, it's a little bit more systematic because the patient comes, sits in your chair, and you're going to deliver the treatment required. So I urge that any person, whether he's a beginner or whether he's been working here from a very long time, to take a lot of time to diagnose and establish a treatment plan. But once you do that, you stand by it, because there is no golden rule or rule of thumb in healthcare services, be it medical or dental. But I feel that we have to stand by our decision of diagnosis and treatment planning and not budge from it, even if there is pressure from all sides. So we take time, don't compromise our ethics, take how much time we want, but once we come to a conclusion, then we stand by it. Tries to get the best among us. Another important thing is the stereotype. We have the cliche, the stereotype, that Indian dentists can be pushed around a little bit. But doesn't happen most of the times. But like how Dr. John mentioned before, that in case a colleague tries to dictate terms and conditions, you know your duties, you know that you're going to discharge them to the best of your ability, and you don't need to care about anything else. Government versus private sector. Well, there's a lot to speak about that, but I try to combine that into patient management. And when we talk about patient management, we know that Kuwaitis love greetings. Okay, it takes about maybe 30 or 40 seconds for them to finish the greetings. And we have to learn that because it's considered a matter of honor to greet the opposite person. So when the patient comes in the clinic, initially the most common phrase utilized for greeting is Assalamu alaikum. And there are many other terms which we will learn over a period of time. And the IDAK committee is coming up with a short book on Arabic learning, which will help us introduce ourselves to a few common importantly used words on day-to-day basis. So initially I feel that according to what I came across, that just a gentle nod or a shake hand is more than sufficient to wish, whether he is a colleague, whether he is a Kuwaiti, whether he is Egyptian or belonging to any nationality, because that's how we greet initially. And the Kuwaiti way of greeting is a little different. Right cheek to right cheek, and sometimes 3 times, beginning with the right and ending with the right, or sometimes nose to nose. Don't misunderstand the guys down. And if it's a lady, definitely, if you even want to have a handshake because of the conservative nature of the society, it's the lady who stretches out the hand first. Otherwise, the same thing, just a gentle nod or a handshake is more than sufficient. Patient management. I cannot talk about patient management to all of you because each one of us is going to manage the patient depending on our credibility and our experience. Definitely we are going to make mistakes, but we are going to come over the mistakes, not repeat the mistakes, and establish our own method of managing patients. But there are some guidelines which may initially help the new person to encounter patient management. Well, just irrespective of any attitude patient or any kind of patient or any type of patient, any nationality of patient coming into your clinic and acting good, normal, hyperactive, hysterical, you have to stay cool. Don't raise your voice, don't let your cool go from you. Be as calm as possible in managing any sort of patient. Stage 1, this is suggested again by an upcoming book by the IDAK committee. I'm just reading it out to you. That the patient enters the clinic, you greet him, he greets you back, sits on the chair, you give him a diagnosis, formulate a treatment plan, he's happy with the treatment plan, all is well, stage 1 is successful. Suppose he's a demanding patient and getting a little agitated, asking a little bit more number of questions, trying to test your patience, then you go to stage 2. You go to stage 2, you use a little bit of diplomacy. Remember not to leave your cool at any point of time. Establish a positive eye-to-eye contact and try to question him, find his problem and try to find a solution to it. Between stage 1 and stage 2, the problem is confined between you and the patient. But if the patient becomes a little bit more vocal and agitated, then you go to stage 3. You catch hold of a colleague who is much more better in Arabic speaking, maybe of Arab origin, and explain to him your point of view. Don't let him meet the patient before you talk to him personally and explain to him the whole funda behind it. Because he has to agree with you in principle before he talks to the patient. If it goes well, absolutely fine. But if it goes out of hand, then the final choice for you is to refer him to the boss. Either you refer him to the boss directly or you take him personally with you and try to sort out the issue in the boss's chamber. At any point of time between stage 1 and stage 4, if things go out of hand, you need to call the hospital security immediately, or even you can call the police. Remember one thing, that there have been incidents of physical assault in Middle East. I would not point out only Kuwait, but it has been an unfortunate thing that there have been a lot of issues of physical assault in the Middle East. Or for that matter, why to single out Middle East? I have come across a lot of physical assault cases in India too, in Pakistan. So no country is an exception. There are going to be these kind of people, hysterical and hyperactive people everywhere in the world, but we need to manage them appropriately. So learn to defend yourself, please don't get beaten up. If you can't, run for your life. Managing colleagues and bosses. This is an interesting one, guys. The M factor. I'm not talking about the Mallu factor because it's going to take more than 1 hour for me to talk about it. But it's the Mudir factor and the Masri factor. When it's a colleague, it's the Masri factor, and when it is the boss, it's a Mudir factor. Now the problem is that you come across one or two or maybe 3 or 4 Kuwaitis working with you, and most of them are excellent human beings. The problem arises when the patient enters the clinic, maybe 2 or 3 patients. And if he's a colleague, you give him the respect he deserves, but don't allow him to intimidate you and get things done from you, because as I told before, you know that what your duties are and how you're supposed to discharge them, and that's about the size of it, nothing more. So the keys to success here is listen more, communicate effectively. Effective communication is extremely important. Reveal, listen and understand the problem, and respect. If we behave with our colleagues and bosses with these 4 factors, I don't think there should be any problem. Responsibility, transforming values into action. Another thing which I have come across in this short span in this country, that the quality of treatment rendered changes depending on the nationality of person sitting on the chair. This is unfortunate. This is letting go of the ethics. So irrespective of which nationality person or which type of person is sitting on your dental chair, I feel the same quality of treatment should be imparted to each individual. Now, the Kuwait Dental Association needs to recognize us as a unit and as a professional group. This is extremely important because as they say that now we are a membership of 204, we know that they already know our credibility as clinicians and how we work for them and the quality of work we impart to the Kuwaiti population. There's no doubt about it, but they're not ready to put it on paper. So we have as a group to work towards it, for them to come to a situation to force them to put it on paper so that we get the financial benefit we deserve. Because ultimately at the end of the day, whether we are back home or in Kuwait or any other place, we are not going to let go of our ethics and give the same quality of treatment to every single patient. So why not get the financial benefit behind it? Ministry of Higher Education. Just a passing mention, 2 minutes more. For the people who have just heard about the Guantanamo Bay and have wondered how the inmates are tortured in the Guantanamo Bay, I urge you to please visit the Ministry of Higher Education. Because right from the time you enter into Kuwait till the time you leave, Ministry of Higher Education continues to haunt you. It's been 3.5 years now and it's still haunting me, so I don't know how much time it's going to take more. So remember that why I'm mentioning this here for the newcomers is try to start pushing your paperwork right from day one and try to follow it up, because the Ministry of Higher Education goes through Ministry of Foreign Affairs to the Kuwait Embassy in India, getting verification from your different universities and follows the way back. So the paper can get lost at any point. You have to follow your paper of higher education, because it's not only important for you in the beginning, it's extremely important for you towards the end also when you're resigning, because I've heard a lot of problems with indemnity issues for those people whose higher education verification has not returned back to Kuwait. So please follow that. Complaints. Dentists can complain about the patients can complain about dentists, and the Ministry of Internal Affairs, the government of the Ministry of Health has come out with an online application form at the address www.e.gov.kw, which says that you can give 3 types of complaints. One is directly to the Undersecretary's office, the second is to the public relations, and the third is to the local newspaper. And then the investigation committee will come to a consensus as to what has gone wrong where, and as of what I have heard, that the people are relatively fair in this respect. That's as far as the government is concerned. As far as the private sector is concerned, there are different private labor laws which most of you must be aware of who are working in the private sector. But in case of any confusion or any confrontation with the patient, you have to register a complaint with the Ministry of Social Affairs and Labour, and there are 5 different labor departments for 5 different governorates where you can go and lodge your complaint. Finally, things to remember, guys. I'm just going to run through this. India is we knew that India is a developing country, but now India is a developed country. I know of so many of my friends who have refused to come not only to Kuwait but other Middle Eastern countries, and surprisingly some of them who have refused to go even to the Western countries because the quality of the healthcare services and especially the IT boom which has taken place in India, specifically at Delhi, Bangalore and Hyderabad, is so good that the salaries are matching the salaries abroad. So people are thinking twice before coming. And as far as the previous trend was concerned, that the people used to inquire as to how much salary I am going to get when I come to the Middle East. But now when I send an offer of job to my friends back home, they ask me how much can I save. So the question and the credibility of the payment sector, especially in the Middle East, is getting a little shaky, but we hope that till we are there, it remains good. Kuwaitis are normal people like you and me. I was forced to write this statement. Do not address anybody as sir, address your colleague as boss or boss as doctor. It makes the conversation a little bit more formal rather than casual. You are the boss of a clinic, not the patient or not your boss. Defend your diagnosis and treatment plan. Watch out for psychos and bullies. At least of what I have seen, the little what I have seen. The minute you see them, boss, definitely you can recognize them. So there's no if and but about it. Treat all patients with the same meticulous nature regardless of their nationality. Stay cool while treating difficult patients. Speak up if you have an issue. Keeping quiet does not work in this country. Using humor is a good tool. Kuwaitis definitely enjoy a laugh. And we are here not because of the people's kindness. We are here because we are the best and they know it. Finally, promotions. I remember what Dr. Jason told me the other day, that in case any of you who have not yet got promotions, the only way to get promotions is to wear a tie and a suit, a new one, every day to job, and don't forget your iPhone. Thank you very much.